How long it takes to recover from coronavirus is different for everybody. So many people feel fine after a few days or a few weeks, and most are going to make a full recovery within 12 weeks. But for some people, symptoms can last longer. The chances of having long-term symptoms does not seem to be linked to how badly you feel when you first get it. Some people have very mild symptoms at first, can still have long-term problems. For many people, long COVID can be much worse than their initial bouts of the infection, with a stubborn and complex array of symptoms. A study that analyzed electronic medical records in California found that nearly a third of the people struggling with long COVID symptoms, shortness of breath, cough, abdominal pain, didn't have any sign of the illness in the first 10 days after they tested positive for coronavirus. And surveys by patient-led groups have also found that many COVID survivors with long-term symptoms were never hospitalized for the disease. A team from the Centers for Disease Control and Prevention found that a third of 270 non-hospitalized patients hadn't returned to their usual state of health after 2 weeks. For comparison, roughly 90% of people who get the flu recover within that time frame. So the cardiologist might track COVID-19 impacts on the heart and neurologists on the brain, but the complete picture was missing. So this is that rare moment where we're evolving in real time to respond to the pandemic. And the response needs to reflect the whole picture, including the silent wave of long haulers. So to get to the bill, the COVID-19 Long Haulers Act aims to address the patient experience. First, by synthesizing our siloed data and understanding what's happening and what treatments work, what are the symptoms, what treatments are recommended. The bill also aims to improve care by researching long COVID treatment efficacy, delivery, and disparities. Far too often, those more persistent and well-resourced will get access to the best care, leaving behind many effective without the knowledge that could help them. So this tries to address delivery and disparities. Educating our public and our clinicians, and most especially our journalists, about long COVID, so they know how to recognize and diagnose the illness and how to write about it.
Over the past year, we have seen increasing reports of individuals who have mostly recovered from COVID-19, but are continuing to experience symptoms months after the initial infection. The problem of long COVID presents is an extreme threat to our ability to fully recover from this pandemic. And I'm glad to see both parties come together to address this issue once again. In combination with the NIH research funding, we have already signed into law the COVID-19 Long Haulers Act will give us the tools that we need to understand, identify, and treat the long-term symptoms of COVID-19. I'm proud to help introduce this bill, and I'm thankful for the work of all the advocates at the Long COVID Alliance and Solve M.E, all that they have done in bringing this issue to the forefront here in the 117th Congress.
This is a debilitating condition that often impacts people's ability to hold down a full-time job. And as the number of people increase, so that the financial impact. It is now estimated that over the next decade, this will have an impact of about $4 trillion on the US economy. The COVID-19 Long Haulers Act, which will provide funding for research, education, and infrastructure, is absolutely critical for long COVID and for post-viral diseases. If we were all doing our job for the past 30 years or so and paying attention to people who are suffering, we probably would have had all the answers that we needed to alleviate more pain and suffering from long COVID.